objective for today is students will be able to identify and evaluate the biomedical therapy. Okay, so biomedical therapy is drug therapy, right? Is one part of it. And so we're going to spend some time talking about the different types of drugs. I'm going to give you guys a chart with all the major drugs and their names and what exactly they do, because I think that will be way more effective. But I do want to take some time and talk about some of the drugs categories themselves. So the first one is going to be antipsychotics. And these are patients with psychosis and the positive symptoms of schizophrenia. So what we should have talked about in your disorders presentations is that positive schizophrenia is whenever you're adding something. So like hallucinations would be adding to your personality. So that would be a positive schizophrenic symptom. Something to be aware of with antipsychotic drugs is that they tend to block dopamine, which is a good thing because you tend to have too much dopamine or a big reuptake. So you can kind of see, this is an example of an SSRI, which we'll talk about in a minute, but you can tell it would block so that dopamine could not attach to your neurotransmitter. One thing about antipsychotics is it just reduces the symptoms. It does not treat the disorder. We don't have a treatment. And then something that we saw in one of the movies is what we call the tardive dyskinesia. And this is where you see a shaking of the hands, okay, or involuntary muscle movement. And that's a side effect of the medication. The second classification of drugs that we're going to talk about today are antidepressants. And antidepressants work for both anxiety and depression. It increases the norepinephrine or serotonin. We call this an SSRI, which is what we call selective serotonin reuptake inhibitors. So you can use this image right here to talk about, you have all these serotonin receptors, and what you're trying to eliminate or inhibit is to prevent the serotonin from going back into the sending neuron. You want the serotonin to go into the receiving neuron. And so you put up these blockers right here so that the serotonin can't get in and then has to go into the receiving neuron. Now, the cool thing about antidepressants is it can treat the disorder. Okay, it does help with symptoms, but also helps treatment. Okay, so we have mood stabilizing medications. One example of this is called lithium, which is actually a salt, and it is very effective for bipolar disorder. It can decrease the risk of suicide. Something to be aware of with lithium, though, is that lithium can prevent future episodes of mania if taken regularly. Which is super important. So if you take it regularly, it can help prevent supermania episodes. Anti-anxiety can be used, it depresses your central nervous system. So essentially it's depressing your fight or flight, right? However, it can cause physiological dependence, meaning that your body needs the drug. Okay, so here we have Rosemary Kennedy. She did have a lobotomy, which you're gonna see right down there. A lobotomy is when the neurons are cut in your frontal lobe. She was a Kennedy. Another type of brain stimulation and surgery is ETC, electroconvulsive therapy. This is used for the severe depression. It's actually can be extremely effective. But it is when there's been no response to medication, so it's like a last resort. In addition to that, we have magnetic stimulation and deep brain stimulation. These are both, okay, just did this before. These are both new or newer, relatively speaking. So magnetic stimulation is when there's transcranial magnetic stimulation that activates specifically the left frontal lobe. There is a negative though. It can lead to seizures and even convulsions. Deep brain stimulation is when they actually implant an electrode. And this again is a little bit further back, but still in the frontal lobe. So we know that a lot of the psychological disorders are targeted around the frontal lobe. And again, kind of a similar concept of like, let's try to stimulate the brain to get the brain to work properly again. And then psychosurgery is lobotomies. Two additional therapies that I want to just discuss for you all is what they call eye movement desensitization. It's rapid eye movement while recalling a trauma. So I'll show you a video on this, or you can look it up to kind of get a better idea of what this is. But it's a long series of lights that you follow. It's really effective if you have one traumatic event. So if there's one thing very specifically, then they find that this can, for whatever reason, be effective. But it doesn't work for somebody who has like multiple or repeated or history of trauma. Light exposure therapy, fun little picture right there, but we do know it's extremely effective for seasonal affective disorder, right? You have a lack of vitamin D. This helps your body produce the vitamin D, which helps address seasonal affective disorder. We also call SAD, so a little bit of depression during the winter months. And that is it for today.